The Pros and Cons to Waterbirth by Claire Cunningham. Today I'm going to be discussing whether waterbirth is more beneficial to mothers and newborns than a normal birth. A personal connection that I have with waterbirth is that since I was in high school, I've always said that I wanted to have a waterbirth because of all the benefits that could come from it. I also would like to be a certified nurse midwife when I become a nurse. My sister had a baby last year, and when she did, the birthing process did not go smoothly at all. The doctors induced her too early and then took her in for an emergency C-section, and the baby had not even come down into the birth canal yet, and they had to forcefully push him down to deliver him. She was traumatized and felt as though everything had happened too early, especially since this was 2 weeks before her due date. She is now planning to have more kids, and she has been talking to a midwife about waterbirth and what it could have changed or done differently for her first birth. The body is an incredible thing, and I think that sometimes we forget what all it can do on its own without all of the things that we routinely try to use for help. I believe it is important to recognize situations where our body can help itself and understanding situations it cannot. Understanding the patient and the patient's body as a whole and not just one thing is super important so that we can help our patient in the best ways possible. The research question that I chose to focus on was, is delivering a baby through waterbirth more beneficial to mothers and the baby than a normal birth is? There was no theoretical framework stated for these studies in these articles. The design that was found in these articles for this study have been split into quantitative design, qualitative design, and quanti-qualitative design. The quantitative designs were 1 non-randomized clinical trial and 2 systematic reviews and meta-analysis. The qualitative designs were 2 non-experimental, observational, descriptive studies, and the quanti-qualitative design included a cross-sectional mixed method study. The methodology used included 3 quantitative methods, 2 qualitative methods, and 1 quanti-qualitative method. The quantitative methods used included 2 cohort studies, one which included a non-randomized clinical trial, and one which included meta-analysis of different studies. The other quantitative method was a systematic review that included a cost simulation model and a decision tree tool to collect data. The qualitative methodology used included a paper-based data collection tool, and the other included a telephone interview. Both of these qualitative methods provide descriptive information about the studies included. The quanti-qualitative methodology includes a questionnaire and a focus group used for the data collection. I have split up the results found into quantitative, qualitative, and quanti-qualitative. Within the results found, I have separated them into pros and cons. The quantitative results include pros of C-section and episiotomy rates lowered, maternal report of pain was lower, no differences in infection rates, and higher APGAR scores reported. And cons of, there are extra costs to waterbirth in hospitals. The qualitative results found include pros of no neonatal deaths with the waterbirths, waterbirths highly adopted in midwife-led units, waterbirths are a positive intervention, and waterbirths relieve pain and promote relaxation. The cons are a lack of resources can cause issues, waterbirths are found to be more risky, and monitoring waterbirths is more difficult. The quanti-qualitative results found include the pros of undisturbed or peaceful spaces for the mothers, and women's enjoyment and midwife's enjoyment was a 10 on a scale of 1 to 10. The limitations from the authors of these studies most commonly found a lack of data present about water births and research found about it. Some other limitations included in these studies were limited authority to change or interfere with routine care or not having the ability to make changes such as medications and drugs received. Studies having a risk of bias in them that's assessed by the CASP criteria, the use of a single reviewer, the fact that lots of women are not educated about water births or don't even know about them, the lack of experience that nurses and doctors have about water birth, which makes it them uncomfortable to perform them, and small sample sizes, which means that the studies may not represent all midwives or all mothers, maybe just the ones participating. Some of the recommendations found from the authors of these studies included having research done with larger sample sizes that need to be designed and approved for the safety and efficacy of water births, more research being done to prompt discussion of what else is happening to impact the decision women make to have a water birth or not, maternity units being recommended to better their resources that they have, such as making more birthing pools available and promoting the awareness of the benefits of water birth. Another recommendation is birth educators updating their knowledge so that they can provide proper care for women interested in water births, and discussion of costs with hospitals so that they are aware and can understand the extra costs that come along with water births and how to handle them. Some personal recommendations that I came upon from reviewing these studies would be staying up to date with all healthcare topics. In most of the articles, the limitations included that healthcare workers were not experienced or knowledgeable enough on the topic, and that can stand in the way of the benefits that come along with water birth. Another recommendation I would have would be to include people who have already participated in water births prior to the study they are participating in. The participants in most of the studies are choosing water birth for the first time. Choosing women who already have had water births could allow for them to have a wider range of women to understand and collect their data on their experiences. In conclusion, I think that the pros of water birth outweigh the cons, and that water birth can be a very beneficial type of care for mothers and neonates. There does, however, need to be more research, more studies, and more outreach information found on this topic. From the study of the pros and cons of water birth, I have learned that water births can take place in a couple different ways, including being held in midwife-led units or in hospitals, in baths, or in pools. I have also learned that one of the main reasons women choose this option is for the non-pharmacological method of pain relief. I learned that water birth can provide a calm, peaceful, and relaxing environment for the birthing mother that she may not experience otherwise. One of the biggest takeaways from this study is how empowering water birth is for women. Not only is it giving them strength and relief in a non-pharmacological way, but it is also proving what their bodies can handle and what they can do on their own without medicines or drugs being received. Most importantly, though, it can be beneficial to the birthing process while enhancing what the body can actually do. This study of the focus on water birth made it obvious on the continuous education that needs to occur from healthcare providers' sides to promote the best sense of care we can for our patients. This is my references slide. Thank you.